Good day! I am Dr. Wilfredo S. Tagle, Urologist, and welcome to this week's episode of Medical PracTIPS, a series of tips and tricks to help you start your medical practice. This episode will be a continuation of Article 3 of the Code of Ethics of Physicians. Be sure to watch our previous episodes to catch up with our discussion. So, get ready, sit back, and relax as we start with our 9th episode of Medical PracTIPS. Article 3, Section 6 is the autonomy of the patient. Physicians must obtain voluntary informed consent before any treatment procedures. That means if you're going to do something to the patients, kahit napakaliit lang po, we have to have an informed consent. Importante po yan. Okay, next. For Article 3, Section 7, it is all about privacy and confidentiality. Physicians holds private and highly confidential what is discovered or learned pertinent to patients even after death, except when they are required by law to promote justice, safety, and public health. That means physician-doctor relationship should be secret. The doctor should not be marites. Okay, and they have to keep those informations learned about the patients during their diagnosis and treatment and care of the patient very secret, even up to the time of he or her death, except when ordered by court. Okay? For Article 3, Section 8 is all about emergent cases. The physician must provide at least first aid treatment to their patients, except in cases wherein the physicians have the risk to his or her life. For example, nasagasaan yung patient. You have to give first aid treatment to the patient, but alisin mo muna yung patient sa kalsada para hindi naman ikaw ang sunod na masagasaan. Or, for example, nasa gera, habang nagbabarilan, alisin mo muna yung patient sa line of fire kasi baka ikaw naman ang tamaan. Then, refer patients to more competent doctors if they are not within your competency. Pag kailangan na ng doktor ng further treatment, ng patient ng further treatment, refer the patient to the hospital or to the neurosurgeon if needed, or to other specialties which you cannot give or which is not within your specialty. But the most important thing is you give first aid treatment to your patients. Once stabilized, that's the time you refer your patient. Okay? Next section, which is Article 3, Section 9. This is about the decorum and behavior of physicians. Number 1 is that you have to free to choose who they serve, except in emergency cases. Katulad ng sinabi ko kanina, the physicians have the right to choose their patients except on emergency cases. Pag emergency yan, syempre, you have to give first aid treatment before you transfer your patients to other treatment facility or to other doctors. Number 2 is demonstrate professionalism at all times with your patients. Dapat laging professional ang dating mo. Huwag bara-bara. Then, demonstrate humility, empathy, and compassion. Laging mababa ang loob. Huwag kang magyayabang sa pasyente dahil hindi mo alam kung ano talaga ang mangyayari sa pasyente mo. Kaya huwag mong uunahin ang pagyayabang. Okay. Then you have to attend to your patients within the limits of your capabilities. Sinabi ko, pag hindi mo kaya or hindi na within your specialties, you have to admit it and refer the patients to a more capable doctor or specialty. Dito papasok ang respect to your patients na mag-second opinion sila. Pabayaan nyo lang yung patients. The more information the patients have, the better you can serve your patients. Siyempre, do not exploit your patients for any personal gain. Huwag yung kailangan ko to dahil meron akong hinuhulugang bahay. Or kailangan ko to dahil para malakas ako kay Mayor. Hindi po ganyan. Laging pasyente ay kailangan natin pagserbihan with all humility and professionalism. Huwag yung dahil kailangan mo yung pasyente. Okay? So I think that's it for Article 3. For this episode, tune in every Wednesday night at 7 p.m. for the latest episodes of Medical PracTIPS. See you!